Hello.
Hello,
Hi, how are you?
I'm doing good.
So nice to I never get to see you.
Oh, I know. I'm like driving, multitasking, obviously.
How's everything
But I
going?
wanted to be part of this one because I have allergies because she's doing so much. I'm at a point where I can try to see if she's not allergic to certain things anymore.
Okay, great. Okay, great. Okay, I'm just gonna let everyone like come in little by little. Hi, Loretta.
Hi, how are
How are
you?
you? I'm good. How are you? How's everything going?
Going pretty good.
Good, excellent. I'm just gonna give everyone a few more minutes to come in. Today we are going to be speaking about allergies and then we'll do Q&A. And actually the kind of allergies that I wanted to discuss in general are seasonal allergies because spring is around the corner. So but we can speak about all the different kinds of allergies that our kids may or may not have and what to look for and some holistic approaches to dealing with them that are addressing both the symptoms and the root cause. Okay, how does that sound?
Great.
Awesome. Okay, I'm just gonna give everyone else a few more minutes. I'll get my notes ready. Arvija, hi. Hello.
Hi.
Hi. Oh wow, everyone's on video today. I'm so excited. So nice to see you. How's everything going?
It's going okay. Thank you. Thank you.
Good. Today is allergy day.
Yeah.
Just give me a few more minutes to admit everyone and we'll go from there.
This is the exact thing going on with us right now. So I was going to post anyways that can we have one session on allergies or sensitivity
I
thing?
know.
And when I saw that, I'm like, oh wow.
Oh yeah. It's not just you. So yes, absolutely. It's that time of year where we talk about allergies everywhere. I'm in my office right now in my practice in New Jersey, and we're doing like live talks in person as well. So if anyone is in New Jersey, New York area, I'll be doing live talks for the community about this as well. So, but I don't know. I think everyone is in different parts of the world. So hi Donna, if you could hear me, hello.
Hi.
Hey, so you can choose to stay on video or not, whatever you're comfortable with would work. So it's 101. Let me just give everyone like a few more minutes as slowly people are coming in and joining. And I'm just gonna ask everyone to mute, please. If you can, and keep yourselves muted, and that way it'll take away from the sound. And if you have to go early, that's just fine. I'll record everything as always and I'll post it up into the program and also into the digital part of the program and into the community. Hey Lauren, how are you? If you can hear me, hello. All right, let me get my notes. 102. Okay. Hi Lauren.
Hi.
Hey, how are you?
I'm fine, thanks. How are you? I'm excited for this.
Thank you. Me too. I know you recently joined, right?
I did.
Awesome.
Yeah.
Big welcome. If I don't think Donna, I think you also recently joined. Hello. And I'm not sure who's in the iPhone, but if you also recently joined, hey.
There
Hi,
we go.
everyone.
Hi.
Hi, everyone. Okay, so you have an option. You have a few options. This is it's going to be a little bit of education. Today we're going to be speaking about allergies, and then we'll do Q&A. So I'll talk for a few minutes so that other people who are still coming in to this live call get a chance to log in. But if you recently joined, just want to make sure that you have access to the digital program. That's a separate access. If you forgot your password, you could just reset it. If you're not sure, just send me an email or post it inside the group. So that digital program has all the information that you need as like a supplement. It's like a textbook. There are so many videos. It's broken down into a lot of chapters. Don't let it get overwhelming. If you're just joining this program, I would suggest starting where it says start here, and it's the 30-day Conquer Eczema protocol, and that's like the most amount of benefit that you'll get in the smallest amount of time. That's the part of the program where you really address the root cause of eczema. But there are other parts of the program that you have resources to, like the private community page, where we can share information and give each other feedback, and I answer questions in there as well and try to kind of custom tailor the information to you. You can also come to these live calls, and if you miss one, a couple of days from the day that we record, I'll be, because my team needs to edit it, I'll be posting inside the group, but also inside the digital program. Got it? So if you have any questions, just email. I'm so happy everyone is here. And on these calls, you could do video, you could not, you could stay off video if you want, and then just pop in, pop back onto video if you want to like do the Q&A part. So I think that any questions about the logistics of the program in general before we begin today's chat about eczema, Allergies Exposed? No, yes, last call. Okay, great. So right now it's allergy season is about to come our way. And I know that a lot of our kids who have eczema also have allergies. I bet you almost everyone here does. Now, allergies is a very broad umbrella term, okay? It means food allergies, seasonal allergies, it could be topical allergies, like things that your child is maybe touching and then they're having reactions. Specifically today, I wanted to speak about the ways we can lower our kids' allergy bucket in general in preparation for allergy season that is upon us. Now, no matter where you are in the world, springtime tends to be the time that most people have seasonal allergies. What we're doing inside the Eczema Rescue Program is working inside out from, gut health, starting from gut health, to make sure that the gut lining is nice and healthy, to make sure that the microbiome is healthy, to lower the allergy bucket from the inside out. Now, this is the long-term approach, but then there is also approaches that we need to take to make sure our kids are comfortable in the short term, right? Like using steroids sometimes is necessary, sometimes using moisturizers. So those small actions that make a big impact to make sure our kids are comfortable. The same problem that landed your kids to have eczema, the same root cause gives your kids allergies and could also predispose your kids to things like asthma, especially later on in life. So as we work towards the inside out root cause approach to eczema healing, allergies will slowly start to fade as well, whether that be seasonal allergies or environmental allergies or even food allergies over time. Now, food allergies does take a while. So spring is springing. The trees are starting to slowly bloom. I'm in New York, so it's still like a complete tundra, but around the corner is the blooming. And so I want to get everybody kind of ready beforehand, so we're not kind of chasing the symptoms afterwards. Allergy sufferers, like most kids, actually, most adults, it's a pet peeve of mine, allergies, because if you ask like most adults, like what medical problems do you have? Even if you ask most parents about their kids, what medical problems does as a pediatrician, I ask this question all the time. And so often they'll be like, no problems whatsoever. I work in a hospital setting as well. So I do a lot of these questions of families that I don't necessarily know. And I hands down, every time they'll say, my child has no medical problems. I have no medical problems. And then I look at the medicine list and there's Zyrtec, Allegra, Flonase, all the allergy meds, right? Even Benadryl sometimes. And that is a problem, because people are getting really used to the fact that allergies are normal, and they're not normal. They're a symptom of a much bigger problem stemming from gut health. This is the approach that I take. This is the approach that I use to help my patients and the families in the Eczema Rescue Program conquer not just eczema, but allergies as well. In fact, this program used to be called 30 Days to Conquer Your Child's Eczema, Allergies, and Asthma. Just so you know, it's very interchangeable. Just because it's so common for kids and adults and everyone to have seasonal allergies doesn't make it normal. So I want you to stop thinking about it as, oh, it's just allergies, because this eventually, if not addressed, can lead to things like autoimmune disease, dysbiosis, on and on and on, asthma especially. So look at it as a burden that can be taken care of. You can approach it holistically. You can approach it by treating it at the root cause. But you do need to approach it. And treating the problem with symptom management, which is the over-the-counter allergy medicines, is not the only solution. And it's not really a solution. It's more like a Band-Aid. So for those of you who have kids or yourselves who are suffering from allergies or seasonal allergies especially, that may mean like sneezy nose, runny nose, congestion, itchy eyes, scratchy throat, wheezing even, needing to use albuterol to open up the airways, coughing, even feeling fatigued. The symptoms are really broad. So how do you know if your child has allergies? And I'm not going to speak about food allergies at the moment, although we could speak about that during the Q&A. And I'm not speaking about food sensitivities at this moment or intolerances. We'll talk about that later during the Q&A probably. I'm speaking about the seasonal allergies, aka hay fever, problems with pollen. So one symptom that you're looking for is the constant runny or stuffy nose. Now, if your child has a constantly runny or stuffy nose year-round, it's most likely dust mites, perhaps, something that your child is exposed to constantly, okay? It is not normal for a child to be constantly with a runny nose. There are symptoms that we as practitioners look for to diagnose allergies that are seasonal or year-round, environmental. So some of those things are having a little line across the nose, okay? And that it's called a salute sign. And that happens when a child is constantly going like this, like it's wiping their nose and going like this. Bluish discoloration under the eyes. Even for those kids who are really fair, you might not notice it to be like an issue, but that bluish like darkness under the eyes, that could be a sign of allergies. On a physical exam, if you're taking your kid to a physician, a pediatrician to get them checked, and just a reminder, I'm not your child's pediatrician. So if you have any specific questions about your child, please ask your pediatrician. This is just general information that is meant to be educational, but we look for bogginess or edema or bluish discoloration in the inside the nares, the nose, and also like specific physical exam findings inside the throat. So there are a lot of physical exam findings that could point in that direction. So again, that if your child is like constantly doing this with their hand, rubbing their nose in an upward direction, that's called an allergic salute, and that is like a little crease across the nose that forms, and that could be a symptom of allergies. The bluish discoloration or dark under eye circles in a child that doesn't go away no matter how much sleep they're getting is called an allergic shiner. That's a symptom of allergies. Mouth breathing or snoring, unless your child is sick with a cold or something acute, not always there, is another symptom of allergies. Having a cough that's persistent, not going away, especially when they lay down, could be from postnasal drip that could be related to allergies. Lots of throat clearing, if you notice them doing like, especially in the morning, could be a symptom of allergies. Having asthma that's worse in certain seasons could be allergies, and even eczema, why we're all here, and frequent itchy rashes could also be an allergy. So how do you know what your child is allergic to? The big question, because there's so many different modalities to try to figure it out. In general, we have a few options. For kids who are, I would say, over the age of probably 2, one of the best ways to do allergy testing is to either do a blood test or a skin scratch test. The blood test could be done with your regular pediatrician to look for allergies, but for kids who are under 2, those results are not very helpful because children are under 2 are still being exposed to a lot of different antigens or environmental factors. And so they're having changes in these blood tests all the time that are not necessarily considered a problem. So testing for kids who are under 2 is a little tricky, and I would leave that up to your pediatricians or allergists to determine whether or not it's appropriate to test your child that way. Allergists can do even more testing with skin scratch testing. So they'll put something that there could be a suspicion of an allergy for on the skin, do a little scratch test. That's usually done with a specialist, an allergist, and that can also determine whether or not there's an allergy to something very specific, whether that be food or something environmental. Those tests are invasive. They're a little scary. You could really get like a big flare up from that. So I would tread lightly and it could even take several visits, and it might be very uncomfortable, very itchy to do these tests. They're not always indicated. You could get a lot of information just from blood work. There are also tests called sensitivity testing, which is a little different. They could also be blood tests, and sensitivity tests don't check for allergies, but they check for sensitivities. Now, there are a lot of different kinds of allergies. Some allergies happen right immediately after an exposure, and others can happen a few days after exposure. So if you're worried about an allergy to like a food, for example, you might want to speak to your practitioner to do the specific testing, okay? Let's see. Some holistic practitioners do allergy testing that's not really evidence-based, but many providers, like in the realm of holistic medicine, find it to be very helpful. It could be muscle testing. Sometimes chiropractors or naturopathic medicine doctors can do those kinds of tests, but they're not as specific or sensitive as allergy testing through a skin scratch or blood test. So the big question is, why does your child have allergies? And I want to point back to the bucket theory of allergies. So let's say your child is allergic to something like dust mites, and maybe a cat and grass and pollen, just like general things in the environment. And imagine a bucket that is more or less filled depending on what allergen your child is exposed to. When the bucket is overflowing, and I've mentioned this bucket overflow analogy in the past, that's when your child will actually have symptoms of allergies expressed. And that could look like runny nose and itchy eyes and an eczema flare and wheezing and snoring and fatigue and just like plain old grouchiness, okay? So you've implemented, let's say, the dust mite protection as best as you can. Maybe you put all the covers on your blankets and mattresses, and you got rid of all the stuffed animals, and so you're protecting from dust mites on a daily basis. But let's say your child's bucket is like at this point 1/4 filled. Now imagine that it's springtime and your child is exposed to grass that is blooming, and maybe they go to a field trip and like with their school, and now there's a lot of grass, and now that bucket is a half filled. Now imagine there's a play date with your child's best friend, and then there's a cat, but your child is allergic to cats, and then that bucket gets filled to the brim. And then when there's one more little exposure, that's when you start to see symptoms. So it's not like just having an exposure, but it's having too much exposure and the body can't get rid of it fast enough. So what you want to do to try to minimize these symptoms is two things. One is try to figure out and heal the reason why they're having so many triggers in the first place. This is where healing the leaky gut, optimizing gut health so they can detox properly, optimizing microbiome so they can get all the nutrients and get rid of the things that is not serving them, so that normal things in the environment are not affecting them this way. This isn't normal to have allergies. So this is the root cause approach, and it does take some time. And in fact, it's a lot easier to get rid of eczema than to get rid of food allergies, and seasonal allergies are a little easier as well. If a lot of kids that I treat actually have significant improvement with seasonal allergies just by reducing things like sugar, dairy, and gluten for some time, not forever, but for some time, because it lowers that bucket of overflow of inflammation. But here are a few things that you can do to, in general, lower the bucket. So you can avoid, if your child is sensitive or allergic to pollen, avoid going outdoors on high pollen days. And although I really have to say that I think going outside is crucial to happiness and health, sometimes having that overflow on those days, I mean, they might be miserable. Like if that's the case, then you might want to stay indoors. keep the house and car windows closed on those high pollen days. The Weather Channel and weather reports actually have pollen advisories, and so you know what to expect on that day, and it varies widely. So especially on days that are very windy, they have high pollen counts, right? High pollen season. You want to keep the house windows closed, the car windows closed, and I am a big fan of having an air purifier that is a HEPA air purifier in the bedroom where the child sleeps. The one that I use in my home is called Air Doctor, and it's fabulous, and it's like worth every penny, and it has been serving us for years. So that's something that you can do to lower that allergy bucket during allergy season. Another approach is when your child is like coming in from the outdoors, or anyone that's coming inside the house from the outdoors, you want to make sure that the shoes are off, because that really does track a lot of allergens into the house. You want to take off the jacket, like anything that they were wearing outside, because pollen will track inside. Change the school clothes when they come inside, maybe wash the face. Focus on the eyebrows and the eyelashes, especially when washing the face. And another approach that I've seen that has been very helpful for a lot of kids is taking a wet comb through the hair, or even washing the hair like right after school instead of right before bed. Let's see, if your child is outside and it's a very high pollen day and they're having a lot of or maybe any environmental grass allergy and that is blooming, you could even carry like wet wipes or wet washcloth and wiping around the nose, eyelashes, eyebrows, hair frequently when your child is playing outside. If you have a vacuum, or if you're getting a new vacuum, try getting a vacuum that has a HEPA filter as well. That could serve to be very helpful for kids who are very much triggered by environmental allergies. Vacuum often, make sure that vacuum has a HEPA filter, clean it out, clean the air filters in your house as well, at least once a year, because those help protect the indoor air. I like to also recommend irrigating the nose after, like right before bed or after your child comes inside, with a very clean product, like at least once a day. I like Neti Pot, but I don't like the solution that it comes with. Two brands that are very clean for nasal saline are X Clear, it's XCLEAR, and also Genexa has a nasal spray, saline nasal spray for kids. They don't have chemicals and they're very, very pure. So those are great. Read the ingredients on anything else that you're buying to clean the sinuses. Let's see. Other ways to manage environmental or seasonal allergies is if you have carpets, get rid of them. If you have a lot of stuffed animals, get rid of them. And this also applies for kids who are allergic to dust mites. So again, dust mites is a common allergy. It's actually very easy to manage. For kids with eczema and dust mite allergies, you can test for it, by the way. So if you know if it's worth taking those extra steps, a blood test is very effective in checking for that for kids who are over 2, dust mite allergy. If you do determine that your child is allergic to dust mites and you're also working on reversing eczema, you want to lower that allergy bucket in general. So what you can do is protect the pillows and the mattresses and duvets with dust covers for these things. Avoid things like feather and down blankets because those trap dust mites a lot more. Get rid of those decorative pillows, they trap dust mites. Wash all the sheets in hot water. If you have like a sanitized cycle, that could be very effective as well. If your child loves stuffed animals, get rid of them from the bedroom, get rid of the curtains as well. It's not worth it. Just stick to blinds. And if your child has like a very favorite stuffed animal, what you can do is like put it in a pillowcase, run it in a highest setting or sanitized cycle in the washing machine, use really clean detergent. I love Branch Basic or Molly Suds, it's great. And then put it in the highest setting in the dryer for about 15 minutes to kill all the dust mites. Also, you can freeze the stuffies for about 24 hours and that kills dust mites as well. So those are some approaches to minimizing how your child responds to the environmental allergies. There are a few supplements that I recommend. They're not going to, I'm just going to mute everyone, sorry. I don't, if your child is prescribed anti-allergy medications like Zyrtec, Claritin, all of those antihistamines, they work very well, but they work to reduce symptoms. Another approach, which you can take, that doesn't work to immediately reduce symptoms, but rather to help the body balance out the response to these triggers, is using a product that is pediatric safe with quercetin and stinging nettles and maybe vitamin C in it. So one product, if you're expecting your child to have seasonal allergies or you're suspecting it, is to use, for kids who are over 5, something called D-Hist Junior. And for kids who are like 2 to 5 years old, you can use Creekside Naturals has a quercetin product as well. Those are all, the quercetin helps balance the body's response to triggers. I would use these products for about a month. They're herbal, they're safe, and for about a month to see max results, but I wouldn't use them for more than a month because they really haven't been studied well for that long. So using it for about a month during the time you expect highest allergy burden for your child is when you want to be using these herbal formulations. So those are some of the things to consider when you're looking at seasonal allergies. Next, in 2 weeks, we're going to speak about histamine response at length. So stay tuned for that. I know you have a lot of questions about food allergies, what to do with other kinds of allergies. So I want to take all of your questions. So let's do this. There's 11 of us here. So what we can do is raise your hand and I'll call on you, or you could also ask questions in the chat box. And again, those 2 medications are not medications, rather supplements that I recommend are Sniflex for kids who are 2 to 5 and D-Hist Junior for kids who are over 5. Okay. Let's see. I actually have D-Hist Junior in my dispensary, and they give my patients and members of this program a big discount. So I'm going to link that link in the chat box if you want to use FullScript to get those supplements. So let's start with Arvija. If you want to unmute yourself, you could do that. I mean, if you want to go back to video, you could do that too, so we can have a convo. Hi.
Yeah, so hi. So for my daughter, we noticed like few episodes where her eczema patches came up suddenly, like in few hours. That never happened with her before. So we suspected that, okay, she may have some allergy. We went to allergies. The only allergy test they did was pineapple test and the environmental test. And pineapple test came negative, although the environmental test came positive with the dust allergy.
Okay.
So now, do you think I should go to the food sensitivity route to find out something more than this? Like, I still suspect I'm not giving her dairy milk from last more than 1 month, and I see her skin is much cleaner than ever. She still complains about itching, but I'm just trying to see that if she's not allergic, what is the next step for me to see and find out, like sensitivity test, or is there any other test I should do on the food products? What I think that she may be having this eczema thing.
How old is she?
She's 3.5.
Okay. Is she doing better in general?
Yeah. She's doing much better from last 15 days. Yeah,
I don't think so food sensitivity tests, the benefit is if you're not sure what's going on and your child is not better, then you can do the food sensitivity test, which is usually extra out-of-pocket cost. It's not covered by insurance. And the negative is that it might give you a lot of results that for a kid who's like under 5 and they're trying to grow and have a lot of nutrient diversity in their diet, and they're already restricted, like she's already restricted of dairy, for example. The negative is that they might have more restrictions based on this testing, and that might not be very valuable information. So if you're like not sure at all about what to do. If she's not better, then you could do food sensitivity testing. Like if you're like
Okay.
completely done, sure. But if she's doing well, better, and you're on the right track, I don't think that you need to go for more testing.
Okay. Okay. I should just live with what we are going with, and if I notice again, then think about doing something else.
Yes,
And
exactly.
I am not giving her the cow milk. She's having cheese every now and then in between, or yogurt in between. But should I go back to cow milk slowly now, or how long I should wait till I don't give her?
How long has she been without
More than 1 month. February.
Okay.
Yeah, it's more than 1 month.
Yeah, so you can now, and she's doing better. So you've done all the different parts of the healing process, right? You've given her stocks, broths, probiotic rich things.
I did not give her probiotic yet.
Mhm.
I'm waiting for her this tiny gut health test to find out which one I want to give.
Okay.
But juicing we have done.
Yeah. Okay, I would maybe wait a couple of more weeks, maybe a few weeks after you start a probiotic, then you could start to reintroduce dairy. The goal is not to remove dairy forever, but you do want to make some changes that help heal the gut, so that if she is exposed to dairy and that was a sensitivity for her, and it was inflammatory for her, then you did something about it, and now you could reintroduce things in a very specific way. So I would refer you to the section that says "My child is better, now what?" and it's protocol of how to introduce dairy in a way where you could see if the problem was dairy in the first place. Okay. So I hope that helped.
Yes.
Yeah.
And for my other questions, I'll go after others.
Okay, great. Thank you. Lauren, hi. Oh, you're still muted. Hold on.
Sorry.
Hey.
Hi. I was the one in the group that was commenting, and I'm really like kind of embarrassed to say how restricted my son is. But while we were trying to navigate this before we started the program, we ended up extremely restricted. He eats red meat, peas, blueberries, and blackberries. And so we started the program, and I knew all along that he needed more nutrition, but it just seemed like every time we strayed from that at all, he would flare. So we started the ginger tea, and he started out having loose stool, and I thought maybe it's just coincidence. So we continued, and then he ended up having diarrhea. So we stopped. Do you think start that again, but maybe just even more diluted, or stay away from it entirely? It's just so touchy, it seems like.
If he didn't have a great response, I mean, most likely it's not ginger tea, but just to be safe, maybe just don't do ginger tea and try something else.
Okay. What would you say to
stocks and broths would be your best bet right now?
Okay. And we have started him. We did Tiny Health. His results were pretty bad. So we went ahead and started the probiotic. Is it okay to do the probiotic and start ferments at the same time? I mean, not at the same time, but
was this histamine level high on the Tiny Health test?
It was not.
Okay, yeah. So I love the Tiny Health test because it's one of the very few tests that check for histamine in a very good way. Ferments are the most potent form of probiotics. They're the fastest way to healing. There's no supplement that's going to be as effective as fermented foods. But they do have a lot of histamine. So I think that probiotics are a nice bridge, and I think you should use them, and you should definitely use the information from the Tiny Health test to pick your probiotics. That's great recommendations. Definitely start stocks and broths and ferments if there's no sensitivity. If there's no histamine overload, just start it slowly. So when you're starting ferments, and there's a lot of detail inside the digital program in week 3 about how to do it. But the most important part is don't start ferments and probiotics at the same time. Maybe start them 1 week apart, and start probiotic ferments like 1 teaspoon a day, and make sure, especially for kids who will have a lot of dysbiosis or like the bad bacteria. What happens when you introduce this too fast is the the bad bacteria die really quickly, and that can cause like a die-off reaction, and it's just very uncomfortable.
Okay.
So you want to start with like a teaspoon, a few drops, small amount, and then you work your way up, making sure there's no symptoms.
Okay. But eventually it is okay to continue the, like, say we go 2 weeks and we continue the probiotic and then introduce ferments. That's
Oh,
okay.
yeah. Yeah.
Time.
Yes.
My other question was, when we are trying to reintroduce things and he has a reaction. So the most recent we thought would be super benign. We started with carrots. We fed him a couple carrots, and we also juiced a carrot, and he flared terribly. So we stopped. Is that, I guess my question ultimately is like, what is a normal, the body is just trying to
How old is-
adjust versus this is a flare and we need to avoid it?
How old is he?
He just turned 3.
Okay. Most likely, that's an allergy if he had such a strong reaction to it. Does he have an allergist?
We are scheduled for allergy testing.
Yeah, I would say that this is the route you need to take when it's so touch and go like that.
And I suspect a latex allergy. And from my understanding, the carrots can be cross-reactive with that. So, okay. Well, that's all my questions. I'll let
At
someone
this point, I would say allergy testing, Lauren.
Okay, we had him scheduled, and then we found out that the allergist does not do the skin test and the blood test in their office. We would have to go somewhere, like we were gonna have to go 2 different places. And I guess intuitively, I just thought, I don't want to do the skin test and then cause a flare. Would you suggest blood test or skin test?
So I would actually leave that up to the allergist to decide which is more appropriate.
Okay. Okay, thank you.
Yeah. Because both could be very useful information. So your allergist will decide what they're looking for. Are they looking for anaphylactic reactions? In which case, skin test would be more useful.
Okay. Oh, I did have one more question. I'm sorry. On the tiny health test, this was actually, we're kind of running this simultaneously for the baby too, along with the 3-year-old, because he's already showing signs. We did tiny health for both, and the baby, he's 8 months, and his came back with 0 bifidobacteria and 0 HMO, which terrified me. Is that a normal finding for babies if they haven't been introduced? Not normal. It's obviously not normal, but does that happen?
Yes, it happens. I see it. And that's
Okay.
usually kids. I usually see it in kids with eczema.
Okay.
So now you know. So now you know what to do. So a bifidobacteria probiotic would be very helpful.
How long do they usually take the probiotic?
So I would say it's a good question. How long, when you start a probiotic, how long to use it? I would say after you want diversity. So after 3 months, it should do its job, and then maybe retest.
Okay.
Not like happy with where it is. But using a probiotic for more than 3 months is at that point doesn't really help anymore.
Okay. Okay. Thank you.
You are welcome. Great questions. Okay, Paula, hi. Did you have a question? Paula? Can you hear me? Okay, we'll get back to Paula. Tish, hi, welcome.
Hello. Yes, thank you for holding this discussion today. So my daughter is 7, and she's had eczema for years. Her, we've been doing everything we can in the protocol, and like her hot spot is the insides of her elbows, and those almost never go away. But fortunately, that's usually her only spot. We had some luck like last winter where there was a few months that it was gone. But I think then when allergy season came back, it came back, and it hasn't been gone since April again. So there was like this beautiful small window where we found some relief, and then have not since. More recently, she's now getting a new spot here under her lip. And so she hasn't had that in about a year. And so I was wondering if is that a pattern for eczema, that this actually means like some food is touching her mouth?
Could be.
And
It could also be atopic dermatitis, which might that depending on the appearance, steroids wouldn't really work well for it. So it could be a food touching the area, but it could also be something called atopic dermatitis that is related to, or perioral atopic dermatitis rather, that is related to eczema, but not necessarily treated the same way. And most of the time, besides this protocol, like steroids topically wouldn't help. And usually Eucrisa works much better for that. But I think that the best way to diagnose that is to see a dermatologist because that's different pattern, like the perioral. If your child was younger and drooling, I would probably say like try that. You know what else you can try, Tish, is having your daughter use Aquaphor as a barrier cream right after washing her face and see if that resolves it, especially before bed. Because drool, yeah.
So atopic dermatitis, I thought that was related to eczema.
It is.
Different.
What I meant was perioral dermatitis. So it's a version of eczema, but has a little bit of a different etaology and treated a little bit differently in the conventional world. Although a lot of kids that I see like in person who only had perioral dermatitis, I treated with this protocol and it helped, but it does take some time.
Okay. Yeah. So you wouldn't suspect foods necessarily because she's already dairy and gluten-free, and we've done food sensitivity testing, and she did have a good number, but the highest was definitely dairy, anything related to dairy and cheese, which we've cut out, and then maybe a few smaller ones. But
was it a recent testing that was done recently?
We did it. I just ordered it myself through, I forget the company. You just order the Everly.
Oh, okay. Everly Well.
Everly, yeah. And we did it ourselves about a year ago.
If she just recently had a change, you might want to retest.
Oh, okay.
Because 1 year is like enough to form new reactions, different reactions.
Oh, interesting. Okay. And then we have not done I heard you just talk about probiotics. We've been kind of doing a probiotic for a long time consistently. Would you recommend a tiny health test as well?
Yes, I think that that's a great test. Very, very helpful when it comes to trying to figure out which probiotics to use most effectively.
Okay.
I'm gonna post inside if you want to do like I have a 20 from the $20 off coupon. I'll post on that in a second inside the chat as well. I think it's very helpful instead of like shooting in the dark, you know exactly what you're dealing with, and it's been a complete game changer for kids when you know what exactly you're working with. If it's histamine, that's the best test for it. If what kind of probiotics to get, you're not like wasting very valuable time and resources in like what's the best probiotic. Well, it's the best one for what your child needs. So
that's helpful. I've been afraid to go on a low histamine diet just because I didn't want to go so far and restricting so many foods. So at least I'll know if that's an approach we have not tried. And so that's good to know that test will help us with that. Okay.
Yes, exactly. Okay. Let's see. Great questions. Tish, did you have any other questions for now?
No, thank you. That's super helpful.
You are welcome. Okay. Hey, Christina, are you there? Christina.
Hello.
Hi.
I don't know why I said driving mode. I'm not driving. Hold on. Hi, how are you?
I'm well. How was everything going?
Oh, I feel like this is such a roller coaster for me. So recently I told you she had an ear infection.
Yeah.
And I tried doing everything holistically first. Like I did at 9 months, she also had an ear infection and it went away. But I did the chiropractor, I did the garlic oil, nothing worked. She still had it, so we had to put her on antibiotics. I was a bit, her, because in October she had like the skin issue that I had to put her on antibiotics too. So this is her second round, October and then now. So I don't know, like I wanted to ask you kind of like, do you still see healing? Like I know that healing is possible, but like, should I expect like a big setback? Is this going to take me so much longer? Like I'm still doing everything, from your protocol. Like she's been on probiotics. I did tiny health. I just ordered I just sent in February before these antibiotics. The first time I did it was before the first one, and it was 85% good bacteria.
Okay.
Then I'm still waiting for the one now, but it sucks because it's not really gonna be valid. Because I just put on the antibiotics now, so I'm still waiting from the results.
Oh,
before.
okay, I see. No, well, it's still helpful. And look, if your child needs to go on antibiotics because it's life-saving medicine, and you've already done so much gut healing and you've done so much, you're never going to be in the same place as you were before. It's a lot easier to restore a healthy microbiome if you already got to that point. So I wouldn't be so too hard on yourself about the fact that she needed antibiotics. You're not like going back to step one at all.
Yeah.
Kids who have a healthy microbiome in general don't have a lot of problems associated with antibiotic use.
They don't. Okay. So you don't see that it's always like, it's not like a huge setback all the time.
Not if you've already done, and I know you've already done so much gut
Yeah.
healing. So
Yeah.
I think that I don't think it's a huge setback at all, and I wouldn't stress about it.
Okay. And then last thing I was gonna ask, I mean, I know this may be something I should ask her doctor too, but I was just gonna ask you to know your opinion on it. Like,
Sure.
I want to do, you had mentioned it to me, to a food sensitivity test for her. And I found one that, sounds pretty good, but it's blood work. And I had her blood checked like 2 months ago. Do you, for kids her age, she's 19 months, she just turned 19 months. Is it bad that if I did blood work 2 months ago and I do it again now, or
No, you
no?
could do it. No, it's fine. It's no big deal.
Okay, so
Yeah.
there's no, it's really like small, like 20 pounds.
No, it's fine. It's fine. They
Okay.
take such a small amount. It's safe. Yeah.
Okay. And then besides like for antibiotic, like I just continue the same healing, protocol, and is there any
I would
extra
double up on the probiotics, like double dose.
double dose? Okay. Okay, thank you so much.
Okay, you're welcome. I'm glad she's better with the ear.
Yeah, thank God. Yeah, that was bad.
Thank you.
Thank
Nice to see you again.
Likewise.
Okay. Mary, did you have a question? Hi. I'm sorry, I'm having a hard time hearing you.
Is it better now?
Yeah, much better. Hi.
Okay, thank you. So I have a question. Just I have baby 4-month-old. We've been dealing with eczema maybe since 2 months ago. So the first thing I did was to remove dairy and gluten, but I noticed some improvement, but it's not completely gone, right?
Mhm.
So the other thing that doctor sent me like a allergy test for me, because he said that it might be something that I'm being allergic to, and it might be something else that I'm passing through the breast milk or something.
Mhm.
So I'm just wondering if that would be helpful, or is it better maybe to do the test for her, the tiny health that you recommend, and is better to figure out what's going on, or
Yeah, how old is she?
what could it's 4 months old.
I would do the tiny health gut test.
Better, because it would be more like something for her
Yeah, and just pick the one, the infant one.
infant.
Yeah.
Infant, okay. And then I would guess that according to the result, then probably might need probiotics, or because I don't see other way to treat the babies that young, right?
Exactly. Yeah. So first thing is she's very young, so you don't have a lot of options, and you don't want to choose a probiotic that is not appropriate for what she needs. So I would do this test. And second is when you start to give her foods, there's a guide inside the digital program that helps you figure out which first foods are the ones that are most healing to eczema. Inside the digital program, it's called the Wholesome Babies Guide. And I want you to take a look at that, because there's recommendations for kids who are 4, 5, 6 months old, and that's quickly approaching. So you can kind of plan out the next few months.
Oh, okay. And how do we find, because I joined the program I think last year, and I lost a
Okay,
little
yeah, you
track of
could
that.
reset your password. Let me send you, I'm gonna
Oh,
text
okay.
to you the
Okay.
password reset link, and then you could just reset it here. I'm gonna send it to you inside
Okay.
the chat.
All
Okay,
right, thank you.
and then
Yeah,
there's
thank
like a
you.
search bar. You
The
could-
link, okay.
Yeah, and then you can search wholesome babies. I really want you to take a look at that guide. It's a really good one, and I put a lot of love into it, and it's very helpful. So
All right.
I just
Thank
sent
you
it to
very
you in a private message, okay?
Okay. Thank you, Doc.
Reset password link. Here's the password reset. For those of you who are not logging in and who want to log in, and by the way, I can see who's logging in, you can reset your password using this link. All right. Let's see, Paula, do you have questions? I called on you earlier, but I think you got logged off. Paula? Hello, okay.
You hear me?
Oh, hey, yeah, I can hear you.
Oh my God. Sorry. So I have a question, just like really quick. In December, we found out that my daughter had mold toxicity. So that was pretty much why, after doing gut health for like a year, she was still like not getting better. She was probably 70% better. I did the tiny health test in December, and she was just low on her bifidobacterium. So I've been working on that for a month. She's halfway done with her mold detox. But previous to that, I did the food and sensitivity test. And most of the allergies that she had prior to starting even addressing her gut issues are not showing on her test. Like
Right.
there's only, she had probably like 15 food allergies, and right now she only has 2. I don't know if that's accurate, but I do want to do like a oral food challenge. So I'm just trying to see what's the best way to do it.
Okay, so just want to clarify, the
Mhm.
allergist did blood or skin prick test, and then they said 15 allergies, right?
At the very beginning, yes,
Yeah,
before
and
we
then-
even started with you.
Okay, and then like a year went by about, and then you did a sensitivity test from Everlywell?
Yes, I did Evexia, something like that. I did
So the sensitivity test and the
both,
allergy are two
yeah.
different things.
But I did both like this
Oh.
last time.
Okay.
Allergies, IgE and IgG.
Okay.
I think.
So the actual allergy testing,
Yeah.
the best way to start reintroducing foods, it really depends on the severity and kinds of allergies that your child had. So there's no general answer, because some of the allergies that are concerning could be like anaphylactic allergies, in which case your allergist will give challenges. Like if there's
Okay.
really bad allergies, the way to reintroduce it is with challenges that your allergist will do in a setting that is safe. It's
Okay.
really important to do it that way. Whether or not it's accurate, probably, because you've done so much to help heal it, and that's the whole point.
Yes. We
Yes.
also did NAET as well. We finished
Yeah.
that. So I think probably the next step is to find a good allergist, maybe.
That whose goal is to do challenges so that your child can
Okay.
eat all the foods.
Perfect.
Yeah.
Okay, that was my question, because I didn't know what to do next, but
Yeah.
I'll work on that.
Because the longer you wait, the harder it is to like reintroduce it.
Yeah.
Right?
Okay.
So used to not having it that you don't want to wait too long. Plus, it's very restrictive. It's probably things
Okay.
that are very healthy in general, right? So
Yes, a lot of them. Yes. Okay. I'll work on that.
better.
Yes, we're almost there.
How old is she now? 6?
She's gonna turn 7 in 2 weeks.
Time flies.
Yeah. But she's looking so much better. I can finally see the light.
Can you send us before and after to help other like in the community group?
I will.
Because I
I
know
will.
it would help a lot other families so much see these, you know.
I know, because at the beginning when I started, I wanted someone to share that they did it and it happened. And I, like I couldn't find anyone, and I want to be that person that can say things get better.
Yeah. Thank you, Paula. You've been very supportive this whole year for the whole community. I appreciate it.
Thank you.
All right. Good. Okay, let's see who is next. Lauren, did you have another question? Just unmute
Oh,
yourself.
there we go. Sorry. Yes, just really quick, because I was thinking about the probiotic, and I did gut testing for myself too, and mine was terrible, which is no surprise. So I was going to start the probiotic, but it just dawned on me, we ordered Smidge for the baby.
Mhm.
Is that okay for me to be taking it and for him to be taking it, because I'm breastfeeding? So is he getting too much by doing
No,
that?
no, it's probably not going through you to him that much, really, to be honest, at this point.
Okay.
So it's safe. Yes.
Okay.
Yeah.
Great.
Not
Thank you.
getting too much. Yeah, you're welcome. Good question. That's good. And breastfeeding helps a lot.
I was
does.
hoping, and then now everybody's still a wreck, and I'm like, what happened? But here we are.
Did you cut out dairy from your diet?
I did actually with my daughter. So she's 5.5. And we just had a horrible start with like colic and belly problems and blood in her stool, and it was just terrible. And so I cut dairy at that time, and she improved significantly. That was 5.5 years ago. And then my son, 3 years ago, I was nursing him a couple weeks after delivery, and things started to kind of turn in that direction, and I cut everything, which is probably not great and probably wasn't great for him, but I was so terrified that we were going to end up in the same situation with the belly issues. So I cut dairy, and I've just been dairy free. I've remained dairy free. I also have a lot of autoimmune issues myself, so I'm pretty restricted. And I thought I was doing a good thing for them in that way. But now everyone's having belly trouble. So I was hoping breastfeeding was going to guard against some of this, but it's not feeling that way.
I wouldn't look at it that way. I would say you're taking all the steps that are necessary, and the testing is very helpful, useful information, and all of this could be very much fixed, reversed, and healed, in my opinion. So just be patient with yourself. You're doing everything you could be doing really well.
Well, thank you.
By the way, like, eliminations and restrictions are sometimes very necessary, and it sounds like you've taken all those right steps then. So just to offload that inflammation. So
Right. Yeah. With the baby, he's pretty restricted because we're all pretty restricted. We were restricted because we thought we were just like cutting grain, cutting gluten, cutting dairy, and doing all these things to just in general reduce inflammation for the whole family. Should I go ahead and start giving him those things? You mentioned, the longer we wait, the harder it might be for him.
how old is he again?
He is 8 months.
Yeah, try it.
Okay.
Wasn't diagnosed as allergic, right?
No.
Try it to give it to him. Yeah, in small
Okay.
amounts.
Okay.
Like,
Before not before the probiotic, because we just started the probiotic, but would you say run the probiotic first?
do
or
the
go-
probiotic for like a week or two, and then
Okay.
go to the section in the digital program called My Child is Better Now What, and it'll tell you how to start dairy
Okay.
specifically. Okay.
Okay. Great. Thank you.
Welcome. You're welcome. See, Donna, hello. Did you have a question?
Hi, yes, thank you for hosting this call. So I don't know where to start. So my daughter, she is 18 months, and she did the allergy test, and come to find out she's allergic to peanuts, dairy, and eggs. Dairy and eggs not as severe, but we did, like, before doing the allergy test, we gave her a little bit of the powder eggs, and she broke out. So that's when we took her to get the test, and it confirmed it.
Mhm.
So, I mean, we removed that out of her diet. So I guess I'm just curious, like, I would like to reintroduce it to her because I know that she's still young and, she can change. When would be a good time to reintroduce it to her?
Sure. So I would say do the eczema, the 30-day conquer eczema protocol, like for 30 days. And then was she not supposed to have it per your allergist who said don't give it to her?
Yes, per allergy.
Okay. Your allergist will do do this program for about 30 days, like giving her the stocks and the broths and ferments or probiotics, juicing, right? And then that'll help heal things up a bit. And then ask your allergist about reintroducing it using a challenge. So he's going to probably put you on a protocol that's like a baked egg challenge. But I would do it in a very specific controlled setting with your allergist, not just by yourself.
Okay. Okay,
Because
great.
the risk is an anaphylactic reaction if they said don't give it to her. There are different formulations of eggs, like baked eggs are a lot less allergenic and easier to digest, and so they might do it. You might tell you to do it at home based on her previous results or new results, or they might tell you to do it in the office for safety.
Okay. Okay, will do. Thank you. Thank
You're
you.
welcome. Thank you for being here.
I have actually one more
Yes.
question. So it was just recent too. So it was just yesterday that she just out of nowhere was just coughing a lot. So I'm like, it could be like the seasonal allergies. Not that I feel like spring is near, because she wasn't having a fever, nothing, no flu-like symptoms, just a lot of coughing. And I noticed that it was right after her like 6-ounce milk that she just took. Like she just drank the whole bottle, 6 ounce. I don't know if milk has anything to do with it, or if it's an allergy, like seasonal allergies.
Yeah, it could be all of those. So I would say make sure that it's not like viral and a real problem with your pediatrician, because it could be any of those things. It could be
Okay.
cold, it could be allergies, it could be, it's like I can't even begin to tell you without checking. So it's worth bringing her to someone to listen to her lungs.
I see. Okay, yeah, because she at night she ended up like wheezing a little bit.
You have to bring her into the doctor.
Okay.
Okay,
got it. Thank you. Thank you.
I hope she feels better.
Thank you.
Let's see. Urvija, did you have another question?
Yes, I have few questions. I'll go. So right now my daughter's skin is clean. Should I still try to do anything, like should I still try to give her probiotics, or I should just let it be?
Clear skin, everything is good?
It's comparatively good, right? Yeah. The only thing when let it be. Okay.
Let it be. Yeah.
Okay. And how about like juicing and broth or
That's always good. That's always healthy. That's never dangerous unless there's an allergy to something that she's eating. But the juicing, broths, stocks, ferments are generally healthy things that anyone could put into their bodies, and that will optimize gut health and detox naturally.
Okay, and cod liver oil, how about that? Should
I like cod liver oil, and specifically the brand is called Rosita.
Right. What exactly cod liver oil does? Like,
So cod liver oil is a supplement that's not always absolutely necessary, but I'm not a huge fan of like a million different supplements, but cod liver oil is generally one that has a perfect ratio of vitamin D and vitamin A in the most natural form. So it's
okay. I gave her one time and she was complaining about tummy ache. So I don't know, it was coincident or it can happen. I gave like 1 drop to her for same brand. What you recommend?
It doesn't taste good, so probably she didn't like it.
Okay.
But tummy ache is not something that I usually or ever really seen as a side effect from cod liver oil. But it doesn't taste good. It's like it's cod liver oil.
Okay. And she's taking this kids sleepology Genixa.
I like that a lot.
Yeah, it's okay. Like she was having flared up. She started from that time, so it's been more than 15 days or 3 weeks. She's taking it. Is that okay? Now she's like she wants this every night. So should I give her till it's get over, or should I stop after a certain time?
How many tablets do you give her?
I used to give her 2 tablets, and now from last 2 days I started 1 tablet.
So this is homeopathic, so technically it's safe, but I don't think that anything is good to use like forever.
Okay, so but I can still use till it's done because she's so
Yes.
much like, oh, I want it, I want
Yeah,
it. So
you can safely use it till the bottle is done.
oh, okay. And her overall skin is clean, but sometimes she feels itchy, and when she starts itching, certain areas become so red, like especially where the eczema used to be. So do you think anything? I mean, I don't know. Do you have any
How old is
comments
she
for
again?
that?
Can you just remind me how old she is?
3.5.
You know, you can give her, if you can consider using ice roller to,
Okay.
if she's 3.5, she wants to itch, if she's itchy, one solution is it's like an ice roller for eczema.
Mhm.
That will, or you could put aloe plant in there, not like real aloe, with water, blend it up and freeze it. That might be more, she'll still, if she wants to itch, she's gonna itch, she's 3.5, right? But this will give her a
Mhm.
little bit more, how do I say this? Kind of control over her body, I think.
Uh-huh.
So, like, you know, if you could, it'll numb the area. Aloe is very healing to the skin. So if you have a aloe plant, you scrape it, put it in blender with water, put it in an ice roller, and let her roll before bed.
Okay. Okay.
It sounds
Yeah.
like she wants to have a little bit more control over the situation. When you say to me, like, she wants this, it probably means it empowers her a little bit. And so
Yeah.
the ice roller, even though it's like, you know, it's a safe way to itch, it might be empowering to her.
Okay, okay. And when I visited allergist, what she said about steroid, applying the steroid, generally the way I do is like I apply for few times, and as soon as I see it's getting better, I stop it. Versus what allergist said that no, keep applying till it's completely clean. Then also apply for 1 week every day, even if it's clean to those areas where it was clean, and then apply once a week to those areas even if it's clean. Do you, I don't know if I should do that approach or no.
I wouldn't use steroids forever, but this isn't, you know, this is one approach to the situation. She really wants to make sure there's no more inflammation. So I'm not your child's doctor, so I can't override what your allergist is saying after checking her and knowing her personally. So, but it doesn't sound like too much, you know, where it's like dangerous.
Okay. Okay. So for steroid, should we just apply, like I use that 0.1 tropical oil. So should we apply till it's completely better, or if we start seeing that it's getting better, then we can stop?
It depends on
Generally,
the
like in
situation. So
general.
there's no in general, it's very specific
Okay.
to each child. That's why
Okay.
sometimes yes and sometimes no. And that's why it's really hard for me to tell you without her being my patient, even though I really
Okay.
wish I could. It's just, it really depends on the severity of eczema and her history and many different other factors.
Okay. And should we do anything specific after we give her antibiotics just to make sure that her eczema doesn't flare up? We had to give her antibiotic 2 times, February and March, and I was so worried about her eczema patches.
Double the probiotics. For
Oh,
about
double the program. Okay,
for about a
okay. That's what you just said. Yeah. Yeah, that's all. Thank you.
You're welcome. Good questions. Mary, did you have any questions?
Hi, yeah, I just want to ask you about that Rosita cod liver oil. I know that I went on the website and it says that you can give it to infants, but is that okay? Is that okay to give it to them? I think this says only 1 drop.
Yes, 1 drop. You can give it to infants. Yes.
Maybe every day, and it will probably help too.
Yes, you can
With
give it to infants.
okay.
Yeah, 1 drop.
Yeah. Because my daughter is 4 months also. Is that okay?
Yes, it's okay.
All right. Thank you. I just wanted to ask
you're
you that,
welcome.
since you were talking about that. I know I was reading about that it would help too, so I just want to make sure. Thank you.
Welcome. All right, my friends. I know that it's 20 minutes before 2:30, but my child is in a talent show today, so I have to go support her. So I have to get off a little early. Any like last minute questions that you want to ask before we sign off? Anyone? Okay. If you think of anything.
Hi, I had a question.
Yes.
I missed a little bit of, I signed on a little late, so I wasn't sure if you talked in depth about allergies. I'm trying to find out whether my son has allergies. I mean, is that basically, I feel like he has a snotty nose almost all the time. Is that a sign that he could have allergies or?
Yes, it
Okay.
should. And I'm actually going to repost this video in a couple of days so you could rewatch it.
Okay, I'll just do that. Okay.
Sorry, I missed the beginning.
Mhm.
Yes, so the answer is yes, it could be a sign.
Okay.
All right, great. Well, thank you so very much, everybody who logged in and spent hour plus here today and doing this program. If you have any other questions, please feel free to ask it inside the community, and I try to answer them multiple times a week, if not daily. So I hope everyone has a really beautiful rest of the week. And thank you. Hi, everyone. Thank you, everybody. Thank you for all the thank yous.